Pathology Anatomy for Semester 5 of Medical School. Pathology Anatomy. 1. Definition of pathology anatomy. Pathology anatomy is a branch of medical science that studies changes in the structure of tissues and organs of the body due to disease. This science connects clinical symptoms with morphological changes that occur, thus becoming the basis for diagnosis and therapy. Main components of pathology anatomy. Macroscopic. Visual examination of organs affected by disease. Microscopic. Analysis of tissue and cells using a microscope. Molecular. Study of genetic or molecular changes that underlie disease. 2. Pathology anatomy learning objectives. Understand changes in normal tissue to abnormal tissue due to disease. Analyze the mechanism of disease from the cellular to organ level. Able to identify morphological abnormalities as a basis for diagnosis. Know the basic principles of histopathology and cytopathology examinations. 3. Main material of anatomical pathology. A. Cell injury and adaptation. Cell injury, reversible injury, temporary cell changes, such as cell swelling. Irreversible injury, permanent damage leading to cell death. Causes: hypoxia, lack of oxygen. Infection, viruses, bacteria. Physical or chemical trauma, free radicals. Cell adaptation, cell mechanisms in dealing with stress, hypertrophy. Enlargement of cell size, example, heart muscle in hypertension. Hyperplasia, increase in number of cells, example, proliferation of epithelial cells in wound healing. Atrophy, decreased cell size and function, example, muscle atrophy due to immobilization. Metaplasia, changes in cell types, example, changes in bronchial epithelium due to smoking. B. Inflammation and healing. Acute inflammation, the body's rapid response to injury. Characteristics: redness, swelling, heat, pain, impaired function. Cells involved: neutrophils, mast cells, and inflammatory mediators such as histamine. Chronic inflammation, long-lasting inflammatory response. Characteristics: fibrosis, lymphocyte infiltration, and granuloma formation. Wound healing, regeneration, repair of original tissue. Fibrosis, formation of scar tissue. C. Neoplasm, tumor, definition, uncontrolled cell growth. Classification: benign, non-invasive, slow-growing. Example: fibroma, malignant, invasive, can metastasize. Example: carcinoma, sarcoma. Stages of cancer development: initiation, genetic mutation. Promotion, proliferation of abnormal cells. Progression, spread and invasion of tissue. Cancer morphology, nuclear atypia, changes in the size and shape of the cell nucleus. Angiogenesis, formation of new blood vessels to support tumor growth. Metastasis, spread to other organs through the blood or lymphatics. D. Circulatory disorders, edema, accumulation of fluid in the interstitial tissue. Thrombosis, formation of blood clots in blood vessels. Embolism, movement of blood clots or other materials to different locations. Infarction, tissue necrosis due to impaired blood flow. E. Infection and immunology, infection. Histopathological changes due to bacterial, viral, or fungal infections. Example, tuberculosis with granuloma formation. Immunopathology, tissue changes due to immune disorders, such as allergies or autoimmunity. 4. Learning methods, a theory, lecture, explanation of disease mechanisms and tissue changes. Case discussion, discussion of disease examples based on morphological changes. B. Practicum, macroscopic, observation of diseased organ specimens. Example, lung tumor, liver cirrhosis. Microscopic, analysis of histopathology preparations using a microscope. Identification of tissue change patterns. Examples, necrosis, inflammation. Staining techniques. Hematoxylin eosin, staining to see cell and tissue details. Special staining, such as Ziehl-Neelsen for TB bacteria. C. Clinical discussion, interactive case studies with doctors or lecturers. Collaboration between anatomical pathology and radiology to understand cases comprehensively. 5. Course assessment, theory exam. Case-based questions about disease mechanisms and morphological changes. Practicum, evaluation of the ability to identify pathological tissue. Group assignment, analysis of a specific disease case based on histopathology results. Portfolio, a complete report on the specimens that have been studied. 6. Clinical relevance. Anatomical pathology is a course that provides an important foundation for disease diagnosis, identification of tissue abnormalities, such as cancer or chronic infections. Therapeutic planning. Determination of therapy based on tumor type or disease severity. Research. Understanding the mechanism of disease for the development of new therapies. This course is the basis for medical students to understand the changes that occur in body tissues, which will be key knowledge in the clinical world and medical research.